Hi, my name is Jordan Boer, and I'm an aspiring data analyst and student with Career Foundry. In my presentation today, I will be discussing how to prepare for the 2018 influenza season in the US, based on my analysis of historical data from 2009 to 2017. The goal for this project is to find out where and when to send additional medical staff to assist with the increase of patients during influenza season. The US has an influenza season where more people than usual suffer from the flu. So we'll look at population data from the US Census Bureau and influenza data from the Center for Disease Control and Prevention, the CDC, to identify what parts of the country suffer the most and may need the most help from the medical staffing agency. Let's get started. We'll first look at vulnerable populations across the country and how it compares to the number of deaths from influenza in each state. But first, what is a vulnerable population? The CDC defines a vulnerable population as patients who are likely to develop flu complications that will require additional care. This includes adults over 65, children under 5, pregnant women, as well as individuals with pre-existing medical conditions such as HIV and AIDS, cancer, heart disease, etc. But for the sake of this analysis, we'll just focus on people 65 and older. So if we look at the map at the top right here, you'll see that the darker blue a state is, the higher their vulnerable population is. And if we look at the circles within each state, the larger and darker red they are indicates a higher number of deaths from influenza in that state. So as we can see, the top 5 states with the highest vulnerable populations are also the top 5 states with the most influenza deaths. That would include California, Texas, Florida, New York, and Pennsylvania. The chart at the bottom left here shows the breakdown of the number of influenza deaths by age group. It's clear to see that our vulnerable population has an overwhelmingly higher number of deaths from influenza than all other age groups. Right now we are seeing it as totals for the entire country, and if we look on a state-to-state basis, such as California here, we can still see that the majority of deaths is comprised within that vulnerable population. And even in states with smaller vulnerable populations and less deaths, most or all of those deaths are in that vulnerable population. So from what we've seen here, we can conclude that there's a strong correlation between the size of a state's vulnerable population and the number of deaths in that state from influenza. When determining where to send additional staff, another important factor to consider is how well staffed a state currently is and the volume of patients that exhibit influenza-like illness in each state. These charts use data from the CDC to provide us with information on patients that suffer from influenza from 100 public health providers, 300 clinical laboratories, and 3,500 outpatient healthcare providers across the country. The tree map on the bottom left shows the percentage of hospital visits where patients experienced influenza-like illness. And the bubble chart on the right shows the number of patients for every one healthcare provider. With this information, we can pinpoint which states may require the most help based on the volume of patients they receive. So as we can see, the District of Columbia has the highest percentage of patients that showed symptoms of influenza, as well as the highest ratio of patients to healthcare providers. But this is just one factor to consider. If we look back at our total deaths, and we get in here to DC, we can see that our data shows that they had 0 deaths from influenza. So if we look back at our charts, states we know to have high vulnerable populations and high number of deaths, like Texas and California, also rank highly on these charts with high percentages of influenza patients and high ratios of patients to providers. So when considering where to send additional staff, all factors must be taken into account. Because in addition to our project goal of determining where to send additional staff, is the goal of reducing the number of lives lost from influenza. So now that we have an idea of where to send additional staff, let's look at when to send them. The charts here show the total deaths from influenza month by month on the top, and year by year across the timeline of our data set. We are also able to see the forecast of the next influenza season in 2018, which we'll talk about in just a minute. First, I would like to point out that the states were grouped by region rather than shown individually. That way it makes it easier to visualize the trend of influenza deaths over time. So let's start with how it looks within a single year. As we can see, the deaths start to increase at a higher rate beginning in September, and then continue rising until January, when they begin to fall again. We do see a little uptick in deaths in March before they begin to fall down until September of the next year. This trend can also be seen year to year, where they generally follow the same pattern, with deaths peaking in January and then decreasing until September of the next year, where they begin to increase again. In more recent years, namely 2016 and 2017 here, we can see the spike of deaths in March is actually higher than the deaths in January, where they were historically peaking in January. And in our forecasted influenza season for 2018, we can still see that these deaths follow the same trend even with that uptick of deaths in March. So, in conclusion, after reviewing all that data, I recommend that we should prioritize sending additional staff to states with higher vulnerable populations and higher numbers of deaths. These states would include California, Florida, Texas, New York, and Pennsylvania. States with higher percentages of influenza patients should also be taken into account, as more help will be needed in hospitals and clinics in those states. Texas, California, and Georgia all fall within the top 12 states in those categories. Additional medical staffing should also be sent in proportion to a state's total numbers in these categories. So for example, California should receive a higher number of additional staff than Georgia because it ranks higher in vulnerable population, deaths, and percentage of influenza patients. And lastly, staff should be sent at the beginning of September and remain until March, since we have seen that this is the height of the influenza season. Now, as for next steps, it's always good practice to increase flu awareness before the start of influenza season, I would say around August, and educate people on preventative measures they can take to reduce their chance of catching the flu and ending up in the hospital. This should be done countrywide, but especially in areas with higher vulnerable populations. We should also monitor the effects of these recommendations by requesting hospitals and clinics to report on a weekly or monthly basis with any deaths and hospitalizations from influenza throughout the next flu season. That way we can see if there were any improvements or if any further analyses are needed. We can also explore other factors besides age that make certain populations more vulnerable to influenza and death, such as gender and ethnicity, those with pre-existing medical conditions, or even socioeconomic status. That way we'll be able to narrow down what areas need the most help when flu season comes around. Thank you for your time, and please feel free to contact me with any questions you may have.